Good afternoon. My name is Wayne Shishido, and today we'll be covering HMSA's new provider orientation. We'd like to welcome you as a new provider and provide you with some information that you'll find useful in regards to different areas you'll be contacting and some basic information about our plans. We'll start with a basic overview of HMSA. Then we'll discuss how HMSA supports its participating providers with tools and resources to assist you in working with us, and tips on filing claims to reduce denials. Finally, we'll provide an overview of HMSA's plans and cover our primary care payment transformation initiative in more detail. These are the topics we'll cover in the first part of our orientation. HMSA has been in business for 80 years, and we have likely served several generations of our membership. We will discuss how HMSA supports providers and some of the teams you'll be working with. HMSA is a nonprofit, member-focused organization, and we are an independent licensee of the Blue Cross and Blue Shield Association, a recognized and trusted brand. Our medical plans currently insure more than half of Hawaii's population, and we're accredited by NCQA, the National Committee for Quality Assurance. We recognize the importance of our role in the community, and the HMSA Foundation provides funding for health-related projects and programs locally. As a nonprofit healthcare organization, HMSA's goal is to carefully manage our members' premiums to ensure the cost of care remains affordable and that members have access to the services they need. Collect just enough premiums to pay for our members' health care and to operate the plan. For each dollar HMSA collects, 91 cents was spent on our members' health care. The remaining 9 cents, plus HMSA's investment income, paid for running the health plan and Affordable Care Act taxes and fees. We aim to help our 7,000 participating providers statewide operating their healthcare businesses as efficiently as possible. We offer a variety of services, including electronic claims filing, direct payment to participating providers, and electronic funds transfer. We have internet-based tools to verify member eligibility or to request prior authorization of services. In addition, we support a web-based provider portal that houses our medical policies and essential administrative information. In addition to a PDF of today's slides, you were sent an HMSA contact list. It looks similar to this slide and includes phone numbers, email addresses, and links to information in today's presentation. You may want to keep this handy in your office. Now here's more detail on HMSA units that support providers. Provider Service Field Associates help with complex claims and reimbursement issues and are available to meet with you at your office. Their contact number is on the contact list. Our Provider Data Administration Unit maintains information including practice location, payee, mailing address that are all important for your claims processing. You work with this department when you registered as a new provider. Be sure to notify HMSA of any changes to your information to ensure you are marketed in our provider directories and your claims are paid correctly. HMSA's Research and Correspondence team responds to written inquiries from providers. Their address is on the contact list as well. Contracting and Facility Relations Unit assists with provider contract development. We now introduce you to a wide variety of tools and resources available so you can do business effectively with HMSA. The provider portal holds much of the information you need to do business with us. You can access it by going to https://hmsa.com/providers. Participating providers may access HHIN, or Hawaii Healthcare Information Network, at no charge to receive information on member eligibility, benefit detail, and claim status. This secure website gives participating providers timely, on-demand information. On the contact list, we include numbers for HHIN outreach, which is to request initial HHIN access or to get training. And there's also a number for the HHIN help desk, which is to ask for technical assistance. In 2009, HMSA saw an opportunity to bring to Hawaii a means of connecting patient and physician using the internet or by phone. We decided to make online care available to all Hawaii residents regardless of their healthcare coverage. Online care is available at no cost to participating providers. Providers are paid for their visits, and weekly payments are sent electronically into their bank accounts. No claims need to be filed. Both PCPs and specialists can enroll in online care and be accessible to their patients. Online care allows doctors and healthcare professionals to expand services outside the traditional practice structure without requiring additional support staff or resources. So now, a patient needing medical care at 8 p.m. or on a weekend can use online care instead of driving to an urgent care clinic. Prescriptions can be sent electronically to the patient's preferred pharmacy. The cost of the visit is charged to the patient's designated credit card. We encourage participating providers to get more information on becoming an online care provider. We'll speak about COSIVA at this point, which is a web-based tool which enables primary care providers to manage their patient populations, to identify gaps in patient care, and to track the PCP's progress in our quality programs. COSIVA is available at no cost, and its secure messaging system allows PCPs to refer patients to specialists and for consult reports to be sent back to the PCPs. Providers can also use COSIVA to send appointment reminders or send secure messages to their patients. PCPs can monitor their performance in HMSA's quality program. The provider dashboard lists the measures, the provider's rate of completion for each measure, and estimated earned payment. From the dashboard, a PCP can click on a measure and get a list of patients who are due for recommended services. COSIVA's care registries are refreshed weekly with HMSA's claims data. We strongly believe that one of the keys to improving a person's overall health is to empower them by bringing awareness about their current physical, mental, and social state. To help achieve this, we've partnered with ShareCare, a company that specializes in health engagement. ShareCare has developed a state-of-the-art health platform and an easy-to-use, medically sound tool, the Real Age Assessment. Working with ShareCare, we give our members and the rest of Hawaii an easy way to get involved, understanding what's going on, and play an active role in their own health and well-being. The Real Age Assessment is available at hmsa.sharecare.com. The assessment gauges how fast we're aging based on lifestyle and medical history. Are you younger than your physical age or older? ShareCare also has a tool that patients can use to find a doctor. Patients can search by provider name, specialty, plans, or office location. Providers can create and personalize their profile to promote their practice. Now we'll move on to pre-certification requests and some of the tools and partners HMSA uses to review those requests. For the purpose of this training, the terms pre-certification, prior authorization, and pre-authorization are interchangeable. A good place to start is to know which services require pre-certification. The links for these resources are listed on the HMSA contact list under the Pre-Authorization Requests section. Once you have determined that a service needs pre-certification, you have the ability to submit requests electronically by first logging on to HHIN. After logging on, you have access to iExchange, which is used for medical, surgical, or durable medical equipment requests. You have also access to EviCore, which monitors rehabilitation therapy services. And you have access to RADMD through Magellan for advanced imaging, selected spine and cardiac procedures, and also to CVS Novalogics in case you're pre-certifying specialty drugs. iExchange is a secure web-based tool for providers to submit their prior authorization requests for medical, surgical, or durable medical equipment. Providers may submit documentation electronically with real-time entry. Auto-approval rules are applied to selected services, and it also provides status updates online. Magellan, which was formerly known as NIA, manages advanced imaging services and certain cardiac and selected spine procedures. Magellan has considerable experience in the field of radiology management. ER, observation, and inpatient procedures do not require pre-certification. Here we list in more detail those services that are managed by Magellan. Requests may be submitted using the website or by phone. For services that are clinically urgent, defined as cases that cannot be postponed for 24 hours due to severe health risks for the patient, please use this dedicated phone line or RADMD to provide information on the case. If you are using RADMD, providers must select clinically urgent indication. Providers must support the need for the urgent requests, and an authorization number is given at the end of the process. EviCore is our partner responsible for managing rehabilitation therapy, which includes physical therapy, occupational therapy, and chiropractic services. Please note an exception. Speech therapy pre-authorization requests are sent to HMSA Medical Management and not to EviCore. The contact list contains links to more information on rehabilitation therapy and EviCore's role. HMSA chose CVS Help to process our specialty drug prior authorization requests, administer our medical policies for specific drugs, and to apply clinical and claim edits to these drugs. Specialty drugs must be filled by a participating specialty drug pharmacy in HMSA's network. Besides dispensing the drug, specialty pharmacies coordinate care between the patient, physician, and pharmacy. There are two categories of specialty drugs: medical specialty drugs, which are administered by injection or infusion, and pharmacy specialty drugs, which are taken orally or by inhalation. Specialty drugs are managed by CVS. A list of medical specialty drugs requiring pre-authorization is maintained by Caremark and is available by using the link on the contact list. Requests must be submitted online using Novalogics, or you can submit the requests by fax or phone. Review the patient's specific drug formulary to determine which pharmacy specialty drugs require pre-authorization. Requests, once again, may be submitted by fax or phone. Novalogics may not be used to submit requests for pharmacy specialty drugs. Beacon Health Options has partnered with HMSA to provide utilization management services for behavioral health and substance abuse for HMSA's PPO, HMO, Quest Integration, Medicare Advantage, and Federal Employee Program plans. They provide concurrent review or pre-certify the services shown here, and also provides case management support, reviews benefit predetermination requests for behavioral health services, and assists with psychiatric decision support and behavioral health referrals. The contact list includes links to more information and phone numbers for Beacon Health options. Next, we'll talk about submitting claims to HMSA. Although many of the slides reference paper claim submissions, much of the same information needs to be included on electronic claims as well. Prior to rendering services, providers should always check if the patient has HMSA coverage and if it's current. Providers may verify eligibility by logging on to HHIN, or they can call HMSA Membership Connection or the Quest Integration Provider Services. All are listed on the HMSA contact list. On the provider portal, we offer basic claims filing for the CMS 1500 claims form and an interactive training tool, which includes a facsimile of the CMS 1500. Blocks on the tool are color-coded to identify required, conditionally required, optional, and not applicable blocks. Click on the block number to view a description for each block. Here are some tips when filing your claims. Use original printed claim forms purchased from form vendors. These forms have red lettering. Transposition errors are common. Ensure that member ID numbers, procedure codes, and diagnosis codes are correct prior to mailing. Clear, accurate information is essential for HMSA to process your claims correctly and without delay. Paper claims are scanned, and for that reason, highlighters and whiteout should not be used. Make sure that your claims are legible and all required and conditionally required fields are complete. HMSA encourages both participating and non-participating providers to submit their claims electronically. Electronic claims result in faster processing and payment. Other available electronic transactions include eligibility verification, claim status, payment reports, and electronic funds transfer. If you'd like to start submitting claims electronically, refer to the contact list for the number to call for assistance. We'll now discuss HMSA's programs. First, we cover some of the different health plans that HMSA offers. Then we'll move on to other programs that you'll need to know about. First, we have PPO plans. PPO plans members may see the doctor of their choice. We recommend that patients select a PCP and establish a relationship with them. Patients have the lowest out-of-pocket costs if they receive services from participating providers. HMO plans offer an alternative to PPO plans. HMO members select a health center and PCP upon enrollment. HMO plans are managed care plans, meaning that most specialty services must be arranged by their PCP. Referrals are made within the patient's health center unless there's a medical reason why the patient needs to be referred out of network. An HMO membership card contains the patient's name, their ID number, their HMO health center, and their PCP's name. Use the member's coverage code information to view their benefits on HHIN. PCPs will refer their HMO patients using the hierarchy shown here. A PCP's first choice would be a provider within the patient's HMO health center. And if none is available, then to a provider in another HMO health center, and so forth. If it's medically necessary to refer to a non-participating provider, the request must be sent to HMSA for administrative review. If services are rendered without a referral, the claim will be denied and members will be fully responsible for paying for the service. If the following are exceptions and do not require PCP referrals, these include emergencies, urgent care, outpatient mental health, vision exams, and an annual GYN exam for females. HMSA's care management support applies to PPO, HMO, and Medicare Advantage plans. HMSA has additional support available for members that could benefit from targeted, personalized health. Referrals may be made by any PCP. Now, let's take a look at HMSA's Quest Integration Plan. Quest Integration membership is comprised of three groups of eligible members. Non-ABD, those who are not aged, blind, or with disabilities. ABD, members who are blind, aged, or with disabilities. And ABD and LTSS. These are members who are aged, blind, or with disabilities and qualify for additional long-term services and supports benefits after an assessment by a service coordinator. This is a copy of the Quest Integration ID card. The plan name is in the upper right corner. If the member doesn't have their Quest Integration card yet, please verify eligibility through HIN or by calling Quest Integration Provider Service. The Quest Integration Plan is a managed care plan with primary care providers responsible for coordinating specialty care for their patients. For this reason, the PCP's name is listed on the card. Also note that the benefit field identifies which group the member belongs to. Service coordination is a person-centered service delivery system that supports patients with special health care needs or those receiving long-term services and supports benefits. Service coordinators assist in coordinating services with other agencies, programs, and community resources, relieving the provider's staff of those tasks. If you have a patient with conditions who you feel would benefit from the services of a service coordinator, please call Quest Integration Provider Service listed on the HMSA contact list and make the referral. When a patient is referred, the service coordinator will schedule a meeting with the patient at a site that's convenient for the patient. At that time, an assessment is done to determine what the patient needs. A personalized plan is created and sent to both the patient and their PCP. The service coordinator then arranges for contracted providers to deliver the care. It's important to know that Quest Integration members cannot be balance billed. Payments to providers must be accepted as payment in full. No-show fees may not be billed to Quest Integration members. There are a few exceptions where members can be billed. These would include non-covered or upgraded services, where members must sign a financial responsibility statement agreeing to pay for those services before services are rendered. Another exception, services are rendered before or after the patient becomes eligible for Quest Integration. As an exception, if a member loses coverage during an inpatient confinement, we can sometimes pay for their stay beyond a member's eligibility. Members who are retroactively disenrolled with our plan presents an unusual situation which may require special handling. If the services end up being covered by another entity, be sure to repay any Quest payment that was previously made on the claim. Primary insurance payments and cost shares are also billable to members. This section describes I'm having a little trouble getting to this slide. Here we go. This section describes HMSA's Medicare Advantage plans, which are offered to Medicare-eligible members. HMSA offers a choice of 2 Akamai Advantage plans on each island, which are PPO plans. New for 2018 is Essential Advantage HMO that's offered on Oahu. A dual care plan is available for members who qualify for both Medicare and Medicaid. Akamai Advantage is a Medicare-based plan which includes additional benefits over and above those included with Original Medicare. As mentioned earlier, HMSA is introducing a new Essential Advantage HMO plan for Oahu members in 2018. This managed care plan uses Hawaii Pacific Health's network to provide services. Members who are eligible for both Medicare and Quest integration may enroll in Akamai Advantage Dual Care Plan. When submitting claims for a dual care plan member, file the claim to HMSA Akamai Advantage Dual Care first, and then the member's Quest integration plan as secondary. The Akamai Advantage Dual Care plan does not combine Medicare and Medicaid benefits into a single health plan. Here's an example of the Akamai Advantage Dual Care membership card. The plan name appears on the top right corner on the front of the card. In most cases, dual care members have no premium after a low income subsidy. Members in the dual care plan have access to services that are coordinated by a care manager whose role is to ensure the seamless transition between care settings, providers, and services. Here we illustrate the model of care process for dual care plan members. Every member in the dual care plan is offered a care coordination where they undergo a health risk assessment. The interdisciplinary care team formulates an individualized care plan for the patient, which is shared with the PCP and with the patient. This time we'll move on to speak about excluded providers. To be a part of HMSA's network, all providers must warrant at the outset and for the duration of their contract that the providers or affiliated providers, which would include owners, agents, or managing employees, are not excluded from participating in federal or state health programs. If found to be excluded, HMSA is required to immediately terminate the provider from the HMSA provider network. In addition, providers must also warrant that they review excluded provider lists to confirm that employees or contractors are not on any list and review excluded provider lists prior to hiring new staff. To view these lists, go to the links provided on our contact list. The lists are maintained for different reasons, so multiple lists must be checked. There are 2 lists for Medicare Advantage plans and 4 lists that apply to Quest integration. Next, we'll speak about the Blue Card program. Blue Cross Blue Shield plans nationwide process claims for one another whenever a plan's member receives services in another plan's service area. When you render services to a member from an out-of-state Blue Cross Blue Shield plan, claims are submitted to HMSA, and participating providers receive their payment directly from HMSA. Payment is based upon HMSA eligible charges. However, benefits, medical policies, and the patient's copayment or coinsurance amount are determined by the plan the member is enrolled in. When members of Blue plans arrive at your office or facility, be sure to ask them for the current Blue plan membership identification card. The first 3 characters of the member ID identify the Blue plan that the member is enrolled with. It's important to enter the entire membership ID on your Blue Card claim. Providers can check eligibility of a Blue Card member by submitting an electronic eligibility request via HHIN or by calling 1-800-676-2583. Providers may verify if services require pre-certification by accessing the URL listed on the contact list or by calling the 800 number also on the contact list. Next, we'll present an overview of the payment transformation model. So, if you are a primary care provider or PCP with HMSA, you'll understand the program and how PCPs are paid under this program. If you are not a primary care provider, this section does not apply to you. Through payment transformation, we want to achieve these goals: better health and well-being for members, to give doctors the freedom to practice medicine as they'd like to, and to achieve the triple aim relating to access, cost, and quality. This program affects, once again, new primary care providers in our audience today. As we talk about payment transformation, please keep in mind the overarching goals. We're moving from volume-based to value-based reimbursement, a journey that's being undertaken nationally by many payers nationally, including CMS. Finally, we're emphasizing management of your entire patient panel, even those who aren't sick and don't need to see you very often. Payment is based upon a per member per month payment for patients that are attributed to you. The base per member per month payment includes office visits, newborn care, procedures such as surgeries, labs, and other tests performed by the PCP. The cost of the vaccines themselves are not included in the monthly PMPM. This is because we recognize that fluctuations occur frequently in the cost of vaccines. They're paid separately on a fee-for-service basis. However, vaccine administration is included in your monthly global payment. We'd like to point out that services for some members are not part of the per member per month payment calculation. Claims for these will still be paid fee-for-service. New PCPs likely will not meet minimum member months requirements under payment transformation. Instead, PCPs in a medical group will receive that medical group's PMPM. PCPs not in a medical group will be given the adult or pediatric network average base PMPM based on your specialty. To be eligible under HMSA's primary care compensation program, a primary care provider must be a participating provider in all HMSA lines of business, commercial, Quest Integration, and Akamai Advantage. They must be a credentialed primary care provider in one of the following: general practice, internal medicine, family medicine, pediatrics, naturopathic physician, or advanced practice registered nurse who does primary care, or a physician assistant under the supervision of a payment transformation eligible provider. The primary care provider must also contract with a single physician organization. That physician organization is responsible for working with their providers to ensure access to care and quality. As part of the move to more value-based payment, HMSA has established quality programs as part of provider reimbursement. We've established primary care and hospital quality programs and will be introducing programs for specialists in the near future. HMSA believes a focus on outcomes encourages the delivery of high-quality and cost-effective patient care. Because HMSA believes primary care is a foundation, once PCPs have joined HMSA with a contracted physician organization and are contracted in all lines of HMSA business as listed on this slide, and have signed a payment transformation amendment to their HMSA participating agreement for commercial, Quest Integration, and Medicare Advantage lines of business, the PCP is eligible to earn payments for performance measures. This payment is separate from your PMPM payments. Under HMSA's quality performance programs, the maximum payment potential is dependent on the patient panel size and performance for each measure. For a detailed look at HMSA's primary care quality program, please refer to the Payment Transformation Program Guide link on the HMSA contact list. If there are some attendees that need to leave the webinar, please complete the evaluation form that was emailed to you and fax it back to the number on the screen. At this time, if you have questions, please type it in the chat area and I'll respond to them unless it's something that requires further research. If that is the case, I'll be contacting you individually after the session with an answer. If any questions do come to mind after the fact, after we've completed the webinar, just include it on your evaluation form and fax it back, and we'll get to that question when we receive it. We'll hold on for just a minute, just in case there are questions. Does not appear that we have any questions at this time. So once again, thank you for your attendance today. Please complete the evaluation form and fax it back to us. We appreciate your participation and look forward to serving you as HMSA. Mahalo and aloha.